I'm Kevin Strickland. I serve as the Bishop of the Southeastern Synod. It is great to be with you this evening, and I hope each of you are well. I'd like to first start with any of our staff who are on with us tonight for very quick and brief introductions, and then whatever Synod Council members we have. So when I call on you, just make sure you unmute yourself, introduce yourself, and then we'll get started with a brief devotion. So Pastor Michael Jeanette.
Pastor Michael Jeanette, Assistant to the Bishop for Formation and Communication, working with our youth, our young adults, and all types of communications, as well as Mental Health Task Force and other items as well.
Thank you. Pastor Jill Henning.
Pastor Jill Henning, and I am the Assistant to the Bishop for Leadership and Administration, and I work with the COVID-19 Task Force, as well as other things.
Thank you. Pastor Karen Boda.
I'm Pastor Karen Boda, and I'm Assistant to the Bishop for Congregational Life.
Thank you. Pastor Matt Steinhauer.
I am Matt Steinhauer. I'm Assistant to the Bishop on a part-time basis as Director of Advocacy and serve as a parish pastor at Faith Lutheran in Lebanon, Tennessee.
Thank you so much. And Pastor Patty Axel. Have to make sure you unmute yourself, Patty.
There we go. Pastor Patty Axel, I am one of the assistants to the bishop and part of the DEM team for the Synod.
Thank you. And did I get all the staff? I was trying to run through real quick. Did I get everybody? If you're a staff person, speak up. Okay. Synod Council, who do we have with us tonight? I see Pastor Beverly Brown Shaw is with us. Beverly, would you unmute yourself and just tell us what congregation you're with?
I'm Beverly Brown Shaw, the Synod Council from the Lutheran Church of the Atonement.
Thank you. Other council members, I'm trying to see who you are, but if you're on there, introduce yourselves. You might be our council person tonight.
I see.
All right, well, we're glad to have that.
Well, hi. This is Mark Ritter. I'm the president of the Council of Holy Trinity in Marietta.
Thank you, Mark. Yeah, and I should have specified Synod Council.
Oh, very sorry. Apologies.
No, that's okay. We're glad to have you on. A lot of you on here are from different church councils, and we're glad to have you as well. And again, keep introducing yourself in the chat function, but glad to welcome each of you tonight. I want to start with a brief portion of Scripture. This is from Isaiah, the 44th chapter. But now hear, O Jacob, my servant, Israel, whom I have chosen. Thus says the Lord who made you, who formed you in the womb and will help you. Do not fear, O Jacob, my servant, Jeshurun, whom I have chosen, for I will pour water on the thirsty land and streams on the dry ground. I will pour my spirit upon the descendants and my blessings on your offspring. They shall spring up like green tamarisk, like willows by flowing streams. This one will say, I am the Lord's. Another one will be called by the name of Jacob. Yet another one will write on the hand, the Lord's, and adopt the name Israel. Hear again that one phrase here. Thus says the Lord God who made you, who formed you in the womb and will help you. Do not fear, O Jacob, my servant, I've chosen you. I'll pour water on thirsty ground and streams onto dry ground and spirits upon all descendants. Where in your life are you feeling dry or weary or in need of God's Spirit raining down on you? Maybe it's not you personally, maybe it's your family, maybe it's your work, maybe it's your congregation. But where in your life are you feeling dry in need of God's refreshing water to be poured upon you? I'd like for you to think about that just for a second. I wish we had time, each of us could share. I am taking a guess and wondering that if you're like me, many of you may feel weary of the constant news streams. Many of you may feel weary from the constant worry streams. Many of you may just be like I am, just really tired of being in your house and ready to see a different point of view. And maybe many of you are dealing with the worries of family who have caught COVID-19, or workers or friends or church members, or the fear of catching the virus, or whatever your worry may be of economics or civil unrest or all the other things that keep us up at night. Wherever you're in need of God's refreshing spirit, I pray that we hold fast and know that the Holy Spirit reigns upon us with gentleness, sometimes with loud breezes, sometimes in the forms of friends or family who just remind us we're not alone in the struggle. So may God be with each of you this night, whatever you're carrying, whatever burden you may have, whatever worry may be upon your heart, and know in this you are not alone in that or your work, and that we invite you into this space this evening to learn, but also to ask questions and to share your concerns, your burdens, and to even lift up in prayer those who are on your heart. So I invite you throughout the evening on this call, if you have prayer concerns that you'd like for me to know about it, or have our staff to pray over, or everybody on the call, feel free to lift that up as a prayer in the chat. We'd also will be inviting you later to list your questions in the chat. But we certainly give thanks for all you do for your congregations, for all you do for the world, and know that your work in the Lord is not in vain, and God will pour out that Spirit like gushing streams upon each of us. Let us pray. Nourishing God, we give you thanks for giving us all that we need in our daily lives. Guide us to those who are struggling in this world, that we may be a source of nourishment to all in need, as others are to us. Open our hearts and minds, continue to strengthen us for service, be with this weary world, guide all those who yearn for cure for this virus, and those who work on the front lines and in the back departments, and those who credit is due and yet never credit given. For pastors and deacons, for church council members, for synod staff, for all who work tirelessly in your efforts. Oh God, we pray this night for a portion of your strength and a measure of your grace. In your name we pray. Amen. Again, I remind you, if you would, please keep yourselves muted. You're welcome to leave your videos on. And we have two speakers. Each will give a presentation for roughly about 15 minutes each. And then following both speakers, then I'll moderate a question and answer time between all of us and them. So if you have questions as they're speaking, if you would keep yourself muted, but I welcome you to write those in the chat box, and we will try to get to as many of those as time will allow. So our first speaker tonight, we are pleased to have with us Dr. Phillip Ricks. Dr. Ricks is a Chicago native and did his master's research at WHO Euro in Copenhagen, Denmark, where he spent a total of 6 years working in infectious disease surveillance and the Danish Institute of Health, and also served as the data manager on the International AIDS HIV Research Study. In 2002, he returned to University of Illinois to pursue a PhD, eventually writing his dissertation. Dr. Ricks has served as the leading epidemiologist supporting outbreak and surveillance training in West Africa. Currently, Dr. Ricks serves as an analyst in the CDC's Global Disease Detection Operations Center, which monitors, reports, and responds to global disease outbreaks. As part of the CDC's COVID-19 response, Dr. Ricks led the team that conducted global COVID-19 surveillance and provided situational awareness to CDC and US leadership. Recently, Dr. Ricks has become a regular CDC communicator to religious communities about COVID-19. Dr. Ricks, it is a pleasure to have you once again to be with us for the Southeastern Synod this evening. We're glad to have you, and we welcome you again. So thank you for being with us, Dr. Ricks.
Thank you for that introduction, and I'm really thrilled to be here. Thank you for having me again, Bishop Strickland. It's good to be on this panel with Pastor Jill and Pastor Matt, Pastor Michael and Pastor Taylor. And I really do value this chance to to connect with religious communities. And I really feel this is an important opportunity for CDC to be engaged with the community. We can write nice protocols and guidelines and stuff, but we really do need to interact with people on the ground in order to do our jobs better. And I am speaking to you as a health scientist, but I would also like to say I am also a spiritual person. I am Buddhist. I have, I know what it's like to miss your spiritual community. You know, we've been meeting by Zoom since March. Our head monk actually had a liver transplant about, I want to say 8 years ago. So of course, no one's getting anywhere near him. We have elderly people in our congregation, friends who are, pregnant. And so I understand how much what a void it is to not be able to come together with your spiritual community. Yesterday, I also got a text from my cousin who had tested positive for COVID, and he works for a facility with people who have intellectual disabilities, and then he tested positive again, and he's asking me all of these things, is he cleared to go? And, I feel the weight of giving him good advice and sound advice for the people that he serves and for his own family. So I'm really glad to be here. I have some slides that I'm going to share with you. Okay, let me see if I can do this. Are you seeing my?
Yes.
Does it look normal?
It looks normal. You might want to put it in slideshow view and go ahead and start that.
Hold on. Okay, let me it's not doing it.
If you go to the top and says slideshow, you can say start slideshow.
Uh-oh. Okay, here's where my is it the correct display?
It says CDC considerations for communities of faith, 3rd August.
Okay. Is it in slide display? In slideshow?
No, you have to go to the top and click slideshow and then put start slide. If you want to send Jill or Michael your slideshow, Dr. Ricks, we can progress the slides for you. And if you want, while you're doing that, Michael, do you have the slideshow?
Yes.
Why don't you
have that?
Why don't you progress it, Michael, and let Dr. Ricks speak?
Okay.
So I will share my screen.
So Dr. Ricks, you can stop sharing your screen, and then Michael, if you would go ahead and start.
Okay, share screen. Okay, am I okay now?
Yes, you just have to tell him when you're ready to progress.
All right then, so can you go to the next slide? These are really some slides with some talking points. I will clean them up and make them a little prettier if you'd like to post them. So can I have the next slide, please? I'm not sure what I'm looking at. So I think everyone knows that the United States has this sort of 3-phase opening, and that at different, there are 6 different categories that you're supposed to meet before you move from one phase to the next. I looked over some of your materials in terms of your guidelines for reopening, and I liked how you sort of laid it out in terms of, the first phase was that everything would be by remote, and then the second phase would be sort of like considering having groups of 10 people, and then the next phase would be sort of groups of less than 50 people. So I liked how that was done, and I think it sort of mirrors very nicely sort of this phase 1, phase 2, and phase 3 approach. I won't go through all of these different items. People sort of know them, and you can read them later. Next slide, please. So this is just US cases of COVID-19. Clearly, one of the first things that people are looking at in terms of moving from different phases is looking at whether or not there has been a 14-day decline in new cases. A lot of the times what people are looking at is this 7-day average. It sort of smooths out the sort of up and down that you see from day to day. But as you can see, the cases in the United States, climbed rapidly in March, sort of did a leveling off and, thought we had leveled off, and then came the end of summer and it continued to tick up in June, and there was some closing down. And once again, we got to, moving into the summer months, and cases started to go back up again. So we really haven't yet seen, we're not sure if we have yet, this is going to be a leveling off in terms of the 7-day average, but as you can see, there has been a dramatic increase since June in the number of cases. Next slide. Next slide, please. So I just want to look at the different states that are here. You can see that for Alabama, once again, that 14-day and that 7-day moving average have sort of maybe plateaued a bit. Not sure if that's just a plateau and going to go higher, or a plateau going to go lower. Next slide, please. Georgia has also seen the same thing. Once again, this dramatic increase starting in June, and the 7-day moving average once again sort of seeming to be at a plateau, but we're not sure where it's going to be going from there. Next slide, please. In Georgia, I put this slide up because this is deaths. Deaths is always a lagging indicator, or you'll see cases rise, and then afterwards you'll see deaths start to rise. So as you remember in the previous slide, you saw the cases started to rise in June, and here in this slide, you see that the deaths, are starting to rise in July, and continuing to seem to be continuing to increase into August. Next slide, please. Looking at Mississippi, once again, this 7-day average is really just on an upward trajectory. It looks at the end of this, the tail of this in August, as if maybe it's starting to fall off, but there is a note that's noting that illness that began during this time period may not yet be recorded. So again, there is sort of often a lag in data, and as data comes in, we tend to get a better picture of what's happening. Next slide, please. This is Tennessee, and as you can see, cases are just going up. So, across the country, we are seeing, continuing, while it may be leveling for the increase, there are clearly certain areas of the country that are continuing to have increased cases. And unfortunately, the 4 states mentioned are the 4 states of Alabama, Mississippi, Tennessee, and Georgia are states where we are continuing to see increasing cases. Next slide. So I know a lot of people want to say, well, that may be the whole state, but I'm looking at my county numbers. This is a slide from CDC where you can go in and look at rates by county. And I just want to tell people that, the different colors for each state represent sort of a different level, but they all sort of indicate, level of intensity. As Dr. Burke said yesterday, you can't really just say that this is only urban, this is rural. This is really widespread. And so it might be nice to think that you're in a county that has low rates, but the county next door to you may be high rates, and viruses do not respect any type of geographic boundary. And people move within states. People commute to different counties for work. So it is in the mix. This is widespread, and to think that you are perhaps in a district or community that is walled off from other places is really unrealistic. So I know that people want to factor that into that, but if you're going to factor that in, then you really need to put in all of the factors. And so I want to sort of talk about some of the other things that people need to think about in terms of where we are, where your state is in this epidemic, and how you want to respond to that in terms of people coming together or continuing to operate remotely. Next slide, please. So looking at the sort of case, I'm not going to go through every state on terms of these different variables, but notice that, you know, the new cases are now in, you know, the age group of 20 to 30. And back in March, we noticed that, you know, the new cases were in the older age groups, people from 50 to 80. So things have shifted in terms of how this epidemic is moving. Younger population, people more mobile, people getting around. So things are have changed in terms of the epidemic. Next slide. You know, one of the things that hasn't changed is the differences in racial disparity and ethnic disparities. The Native American population has really had the highest rates, followed by non-Hispanic Blacks, and then by Hispanic and Latino communities. So in thinking about your congregation, you will of course need to think about the racial makeup. And in some ways, a lot of this is driven by some of the issues that are on the next slide. Could I have the next slide, please? This is looking at cases by underlying condition. So when you're thinking about your congregation, you're thinking about who is going to come, you have to think about people who are at higher risk for COVID-19. From this slide, you can see that that people with hypertension, diabetes, cardiovascular disease, obesity, that these represent people who are at higher risk, and of course, people who are over 65. So when thinking about your congregation, you want to think about who is going to be there in terms of age, your racial profile, underlying conditions. All of these other factors will be important to look at. Next slide, please. When trying to think about where you are in this epidemic, there are a lot of other factors to consider. We're concerned about, of course, a lot of people are concerned about hospital capacity, the healthcare system being overloaded, adequate PPE. So, you know, we start to look at other indicators like hospitalizations. This is, you know, hospitalizations for Alabama, and as you can see, it's, you know, increased quite steeply since the beginning of June. Next slide. And this is another way that we measure usage, and it was one of the criteria in terms of the different phases, is looking at ICU bed usage. You know, we become quite concerned when we're running out of ICU beds available. So, you know, it has gone down a little bit since the beginning of July, from 22% down to 16%, but there's still availability. You start to be concerned when that goes down. So when you're looking at your own state and your own community, you need to think about, you know, the healthcare system and what can be provided. People becoming sick can become very dangerous if there isn't adequate healthcare. Next slide, please. And a lot of talk is about testing. And testing is important because it lets us know where cases are happening. It gives us an idea of how much circulating illness and virus there is in the community. So we look at testing percentages. This is for Alabama, and the green bars are the absolute number of tests, and the maroon line is the percent positive. And of course, you know, as you start to increase testing, you will see percent positives increase. You hope that as you continue to increase testing, you hope to see the percent positive fall off, because you hope to not be just testing the people who are coming in who are perhaps exposed or at risk, or who for some reason think that they have been exposed. So as you start to test wider in the population, you expect for this rate to go down. It has been a little bit of a decrease in the past, in the last week that's on this graph. But again, these numbers bounce around a bit from week to week, and there's always a little bit of lag in terms of data. In terms of testing, there are a lot of other caveats in terms of who is doing the testing. Next slide, please. So Harvard Global Health Institute has a map that does COVID risk level by state. And as you can see, the 4 states are in red, which are at highest risk for COVID. And this is based on the 7-day average case per 100,000 population. So, here in the South, we are in a very high alert situation for COVID-19. And I think that has to be an important consideration when people think about how to come together as a religious community. Next slide, please. Next slide, please. Okay, next slide. So, we can mitigate a lot of risk. We cannot get rid of risk. And I'm just going to sort of quickly go through some of these slides, because a lot of this is information that's on the CDC website, and it would take up a lot of time. I want to say that I did look through your materials, and I noticed that a lot of these points were in your guidelines and your guidance, and I thought that your guidance was really quite good. So I'm just going to go through briefly. Some of the things that we all know to do in terms of reducing the spread of COVID is staying at home when you're sick, social distancing, hand washing, cough etiquette, and wearing a face covering. There are other, of course, environmental precautions that we're taking in terms of cleaning and disinfecting the environment. Next slide. Promoting healthy behaviors that reduce the spread. Again, staying at home, face coverings, hand hygiene, but also in terms of your work environment, of having adequate supplies, signing in messaging, and all of these different types of things that you can do to reduce the spread of COVID. Next slide, please. Maintaining your healthy environment, cleaning and disinfecting, and being concerned about the use of restrooms, your ventilation systems. We've been warning people about their water systems because a lot of buildings haven't been used, and water systems need to be checked before people start to reuse these facilities again. Putting up physical barriers and guides to move people around. Closing off perhaps areas that were normally communal spaces in order to prevent people from gathering. And a lot of the discussion in terms of faith communities is a lot of the shared objects that happen during religious services, from booklets to communion, to shaking hands and greetings, and all of these things that need to be taken into consideration. And I noticed that your guidelines did address a lot of these issues. Next slide. Maintaining healthy operations. So participating in your community response efforts, so you can know what type of emergency services are available, what type of community response you could fit into, being flexible and responsive, and all of these other things, issues of childcare and youth programs. If you are going to be meeting, cohorting certain groups together so that you don't have mixing of groups, having staggered schedules for your workers. All of these different things can be implemented in terms of your operations. Next slide. And of course, we do have to prepare for someone gets sick. You need to be sure that you have a plan in place to advise sick people in terms of home isolation. What do you do in terms of transporting someone who becomes sick at work, cleaning and disinfection protocols, and notifying health officials and close contacts. These can become real important concerns when you have a sick staff or you have a member of the congregation who is sick. So there's a lot that goes into trying to prepare to have people come together to worship. Next slide. So I just want to, sort of close with this guiding principle to keep in mind, and that is, whenever people come together, whenever as this says, whenever people interact, the longer the interaction lasts, the higher the risk of COVID-19 spread. Location can be a factor, with outdoor activities generally being less risky than indoor activities. So whenever you've got people coming together, there is risk. There you can mitigate some of this risk, as it says, based on location, in terms of having people meet outside, social distancing, all of those other measures that I sort of talked about. So the lowest risk, of course, is, meeting, virtually, and only essential activities do you have people come together. There's more risk when you have small groups. Outdoor activities, of course, are, a priority if you can arrange them. Keeping again, that cohorting, as I mentioned, keeping perhaps households together if they are going to come and worship together. Again, higher risk activities are outdoor, are indoor activities with social distancing and wearing of masks. And of course, the highest risk would be, having indoor operations that are large and where it's difficult for there to be social distancing. So I would like to, leave you with the thought of, assessing risk in terms of having people meet in person and what you can do to mitigate that risk. And knowing that it will not be zero if people come together, and that we are in a time where in this part of the country, there is a high level of alert in terms of COVID-19. And so people need to factor that in. To think that you're in one corner of the state and you're not vulnerable, I think would be incredibly naive and perhaps even harmful. I know how important it is to come together, and part of it being community and taking care of each other, but I think you also have to be concerned that you take care of each other if you do decide to come together. So thank you very much for allowing me this time to speak. And of course, I'll be happy to answer questions during the Q&A session. Thank you very much.
Thank you so much, Dr. Ricks. What a pleasure to have you tonight. And this is your second time speaking with our Synod. So great to have you. There are questions that have come in. We're going to wait until after Pastor Byron-Edwards is finished. Next up, we have Pastor Taylor Byron-Edwards, who I have known for a number of years, and prior to being his bishop. Taylor, for much of his ministry, has served in the United Methodist Church as an elder and was the director of worship resources with discipleship ministry for the United Methodist Church, which essentially was the same counter position that I had prior to being bishop, where I served as the assistant to the bishop for worship for the ELCA. So because of us having very similar positions, Taylor and I have known each other for a while, and I have considered him a colleague and friend. And Taylor, even as your bishop, I still consider you a colleague and friend. But Taylor has gone through the candidacy process and become part of the Evangelical Lutheran Church in America, and we are glad and thankful to have him as part of the Southeastern Synod, where he's currently serving at Faith Lutheran Church in Warner Robins, Georgia. Taylor serves on a number of committees and task forces, and some of those include the Consultation of the Common Text, the North American Academy of Liturgy, where he's the secretary, the Liturgical Conference. He's also a member of the Order of St. Luke. He resides here in Georgia with his spouse, and they have 2 sons. Taylor most recently has been incredibly instrumental in putting together with Dr. Ed Phillips from Emory an ecumenical guidelines for worship, which is incredibly resourceful and incredibly ecumenical, probably the most ecumenical thing that we have in the United States. And Taylor, I didn't count correctly, but I think there's something like 8 denominations represented in this resource. So you have certainly had your work cut out for you these past few months. But Taylor, it's a pleasure to have you with us tonight. And Taylor will be speaking primarily around liturgy and worship and precautionary things that many of you have already been putting into place and thinking of as you're thinking about what it means to phase, but also knowing that many of you have phased in and now had to phase out. So Taylor, thanks for being with us and look forward to hearing what you have to say.
Thank you. Let me share my presentation with you. One moment here. Let's see, I think it's going to be this one. Okay, so are you all seeing the presentation slide as the presentation?
Yes,
Okay.
thank you.
So as Simon Sinek said in his TED Talk of some fame a while ago, always start with why. So why is consultation into being? We wanted to provide, we were seeing a lot of guidance for churches put out by adjudicatories. And as congregations toward the middle of April were beginning to consider what resuming in-person worship might look like, but what we wanted to do was to bring together a broader sense of people ecumenically and a broader array of disciplines to develop resources for what congregations can do. A lot of what we were seeing in judicatory guidance was a list of things not to do. And we wanted to really focus on what you can do and provide guidance from liturgical theologians, experts in health, both infectious diseases and people from CDC who were gracious to review everything that we provided. Guidance also the pastors need, as well as guidance that comes from the angle of what do bishops and leaders of judicatories need. So all these into dialogue with each other, plus the ecumenical element of this, principally among three denominations, the ELCA, United Methodist Church, and the Episcopal Church, because we have a very common sort of theology of worship and understanding of the nature of sacraments together. And so we thought it would be a good starting point. But we also wanted to involve folks from the which is
Taylor,
yeah.
Taylor, there's a lot of you're really garbled.
Okay.
I'm not sure what's going on. You're okay at the moment.
Okay.
But we've turned your video off just so you're aware. We're hearing probably about I'd say 70% of what you're saying.
Okay.
You're just a little garbled. So at this very moment you're fine, but I'm not sure what to do about it. But just so you're aware.
Understood. Thank you. So why these partners? A, because we do share this common Catholic theology around the sacraments. Another important because of some of the research that was starting to come out about singing. Song music, as well as our shared concerns about the liturgy. So how do we proceed? Ed Phillips, who's a professor of worship at Candler School of Theology at Emory University, along with Larry Goodpaster, who is a bishop in residence there, retired United Methodist bishop, and I, invited partners from across all these denominations and across multiple disciplines to gather together and to begin to produce short papers on three main topics. What does re-entry into the worship area look like together? What do safe core practices, including our practices of the sacraments, look like? and what are some other practices that are common across our traditions, including things like laying on of hands and extending the table to those who are unwillingly absent, look like. All along the way, we were working on a basis of what are some core principles that we want to attend to in each of these things, and then what are the practices that flow out of those principles that can guide what we do. We proceeded publicly.
Taylor, let me interject real quick, just because I don't want to keep interrupting. Why don't you stop sharing? Let me have Michael quickly share and close any other applications you have.
Okay.
And let's see if we'll start right at the slide you were at. And I apologize to everyone on the call. This is just what happens with technology in Atlanta area. We've had a lot of storms today.
Yep.
So just folks, be patient, realize technology works when it does, and when it doesn't, it doesn't. So Michael, if you could go to that slide that Taylor was on.
How do we proceed? And it's publicly. Keep going.
There you go.
One more. There we go. So we're meeting once a week by Zoom and streaming our 3-hour meetings to Facebook Live. We were discussing the papers that each of the different groups had brought together for each of our three major sessions. Behind the scenes, between meetings, we as co-conveners would work to pull all the edits we were getting from our conversations together, as well as try to bring all of our work down into a coherent whole. After our third meeting this way, we met together.
Taylor, we lost you again with your sound. I'm not sure what's going on.
Yeah, I don't either. Let me try something else.
Can
you hear me now?
We can hear you now. Let's keep trying. And if not, what I'm going to suggest we do is just stop and we'll just proceed with questions.
Okay. So we met once a week by Zoom. And then after all these meetings, Ed and Bishop Goodpastor and I really worked together to form pretty much the final document that got wide approval by the whole group. And we put that into the editorial process, releasing it June 8th. And document in Spanish, also bringing together people, Spanish-speaking leaders from across our denominations to develop that document in Spanish in a way that would work specifically in North America. You can go next. So what did we conclude? The first thing that we concluded as a consultation was we were going to follow all of the public guidance the CDC had published, including its initial guidance about churches. And we were also going to follow all of the written suggestions that the CDC would give us. Each week after we finished our consultation, we would take all of our agreed upon practices and send those to the CDC for comment and get those comments back and edit based upon their comments. We strongly commended the 3-level approach, keying staged opening to progressive 2-week periods of decreasing cases, and the principle of pulling back should increases occur. And when we did the Spanish language version, as things were already starting to pick up again with coronavirus and COVID-19 infections, we actually even strengthened that more and put some more strong language around, if you're seeing cases increase, stop, do not proceed further. Next. We concluded that we share 5 core commitments that inform our guidance about what we can do when we meet in worship. First of all, love. Love for God and love for one another. A care for human bodies and the importance of human fellowship by whatever means that can occur. A strong commitment to sacramental life with as much integrity in our practice even where it has to be mitigated a bit by what the pandemic is doing. A focus on inclusion of as many people as possible without stigmatizing those who might have to be excluded. And a focus on beauty as a principle that whatever we're doing, we want to make it as beautiful as possible. Next. And so these are the things that we were very clear from our early days of things we just knew we could not do. We could not commend singing as choirs or congregations in worship. The research was showing that was a bad idea. Or doing any kind of unison responses for similar reasons for congregational singing. We're really commending not talking or preaching loudly because of the stronger projection of particles and aerosols that could happen with that. We could not be physically distanced, and similarly, we could not wear face cloth coverings. We need to wear those cloth face coverings. We could not stay for fellowship hour before or after. We could not meet for worship or other events indoors as long as we were accustomed to. And we could probably, in most of our churches, not have more than one person in restrooms at a time. Next. But here are some things we realized we could do. We could absolutely be careful to make worship as possible. We could make instrumentally by clapping in both kinds with great care. We could celebrate baptism with great care. We can extend the table safely to persons who cannot receive and be gathered with us. And as we were developing the protocols for how to do each of these things, as I say, we passed them by the CDC and got their input in everything that we finally produced. Next. You can see this document, Resuming Care-Filled Worship and Sacramental Life During a Pandemic, in Spanish and in English, at our consultations website, at our Synod website, and at the Ministry Matters website. And we're aware that there are multiple other people who are, and entities that are publishing this time, and we're grateful to see this resource get out there as widely as it is. Next. So Warner Robins is in Houston County in sort of south central Georgia. And as the pandemic was continuing well into June, our case numbers were fairly low and staying really low for the most part into early and mid-June. And so we decided that we were going to try to resume worship again. People were having great dissatisfaction with Zoom, and you can see some of the reasons why that might be in tonight's presentation. But we felt like we really needed to try to meet if we could. And so we implemented all the practices suggested by the Synod document and by Resuming Care-Filled Worship in what we were able to do at that time. Next slide, please. Next slide. Okay. When we were beginning to consider this on 6/15, our average case count in Houston County with a population of 175,000 was 5 per day. So we were able to return to worship on June 28th. And it was still a fairly low case count. But within 2 weeks, it had quadrupled to 23. And so we decided after 2 weeks of meeting together, it was time to cease meeting together for the time being, to put a pause to that. And as of today, even, the average daily case count is now 40, where we are. One of the things that was that our Synod, our local church council decided was that we were definitely going to implement the Synod guideline of waiting 2 weeks of continuous decline before trying to resume. And we're still in a phase of rise or plateau and not real decline at this point. And so we don't know when we'll be able to resume worship again. But we feel like we've got good guidance from the Synod, from this document, good support, and looking for the opportunity to be as helpful as we can and be positive witnesses of healthy practices around worship when we do resume.
Thank you so much, Pastor Byron-Edwards. Really appreciate you. I'm sorry for the technological issues. I've had many of those myself. Let's go into questions real quick. The first is, this is to Dr. Ricks. How do you explain that these are actual plateaus versus delays in testing and reporting? Many of our states still take 7 to 10 days to get a test result unless you are hospitalized. Testing positives rising to some centers in Alabama having 20 to 33% of those tested being positive. Couldn't this also be hampered by all the colleges getting lots of tests and overwhelming the testing centers? We've heard that locally.
Yeah, all data, of course, has some, caveats in terms of the time that it takes to get data. Some, states are having different delays in terms of getting test results. Here in Atlanta, it also depends on the test site. So we know that some of this testing data is not complete. So are these truly plateaus? We don't know yet. This is why, for example, for instance, we sort of use the 7-day average. So we sort of smooth out that curve. And we know that from week to week, we're going to get in more data, so it may change. So absolutely, there are probably some reporting delays. It happens with data. In terms of, the number of percentage positive going up as you increase tests, this usually happens because you focus on testing people who are ill first. So as you start to get more tests and test more people who are coming in with symptoms, of course your percentage positives are really high. You hope that as you expand testing to the wider community, you're going to start to see that on variations. Like you said, if there's a college that's getting a lot of student, your percentage positive rates. Generally, we look at testing and we look at it in different types of sort of phases in terms of sort of one, people who are with symptoms, then maybe the second group is expanding this further to cases and contacts and the wider community. So we look at it in terms of sort of the different phases, and these can vary locally.
Thank you. Dr. Ricks, while technology is in our favor, let me ask you a couple more questions that have come in. How has increased testing affected the increase in COVID-19 positive cases? You sort of answered that. Do you want to say any more about that?
No, it's just it's really just that in the beginning, we tend to test people who are ill. So as we roll out and get more and more tests, you start to see the number go up simply from more testing. But you do sort of hope to have a plateau when you sort of roll out testing to the wider community. You hope to see that percentage of positive cases start to decline.
Thank you. This other question has come in. Are masks with port valves discouraged, as in the inhalation is through a filter, but the expiration is unfettered through a valve?
Yes, those are discouraged. I mean, one of the reasons that we have for having cloth masks is that it's a barrier for things going out. So if you have a port valve that allows the expiration to be unfettered, and you talk and you have COVID virus, you're putting virus out into the air. So no, we recommend, regular not surgical masks, because we like to keep those for the hospitals, and not N95, but cloth, mask, bandanas, a lot of the things that people have been wearing, but definitely not port valves.
Thank you. And this question could be for Taylor or you, Dr. Ricks. What benchmark data points are the most critical in establishing when to reopen our churches? Dr. Ricks, I'll let you start with that.
Yeah, I'm probably gonna go with, I think that the first benchmark that everyone talks about is, are cases increasing or decreasing in your community? And you may want to define community very widely. You may want to make it the state and not just your county, to be on the safe side. Also realizing that, before you start to see a case, virus can be floating around without there being cases. People are shedding virus before they develop symptoms. There are people who are shedding virus who don't have any symptoms. So, one is to be really careful about thinking, oh, we don't have any cases, so it's okay. I think that there needs to be a lot of consideration for the fact that a lot of the transmission of COVID-19, is really widespread. We're talking it's community spread at this point. It's not clusters, it's not contact. So I really sort of look at that one first.
Thank you. Taylor, did you want to jump in there with anything?
Yeah, that's what we're doing. We're looking at case numbers, and I've got a chart of data from the Georgia Department of Public Health website going back a month and a half now, keeping track of the data every day, looking at the average daily, the daily average of count over a 2-week period.
Yep.
Can I just say this? And now I'm actually going to take off my CDC hat and sort of be, Phillip Ricks hat. And that is, I know that we used 14 days because that's the incubation period, but I think that realizing that we do have delays in data, it is highly transmissible. Come September, we're going to start to go into flu season, and we're expecting another potentially a wave of more COVID cases. I would advise people to perhaps look at 2 weeks as perhaps a minimum. No one wants to get out there and be caught in a wave, and with not knowing where numbers are really going. I think Ambassador Burke said, August is going to kind of be a critical month in terms of which way are we going to kind of break on things. So I would suggest that maybe 2 weeks is a minimum.
Yep, thank you. And I just want to point out that I put the web link there for COVID-19 risk from Georgia Tech. And you can put in your county that you're in, but you can also widen that to the counties around your church or where you live. And it will show you what your risk is depending upon what number of people you're around. Like, for instance, I did not go to a church 2 weekends ago because I put my risk there with them having just 25 people. I was at a 54% chance risk of catching COVID. And that was even with them doing all the precautionary things. The other question that's come in is, how do we monitor the water systems at the church? Dr. Ricks, you would be proud of me. I've actually I've been encouraging people for months now to flush their toilets and to turn on their sinks in their churches. So I was told by one of the CDC employees that I should encourage people to do that. So we've been doing that, but how do we monitor the water systems at our church? Do you have any suggestions for that?
I think that there are companies that will actually come out and test your water system. The problem we've been finding is that people have been shut down, and we've found that when people suddenly go back in, we've gotten some instances of Legionnaire's disease, which, and so people may need to come in and test tanks and do some just testing really for that issue. That's been the big issue, and keeping water running so that it doesn't get stagnant. But it has been sort of the Legionnaire's issue, and it's come up quite a few times.
Thank you. And then the other question is, do we have any advice, suggestions on things we can do as congregations to advocate for community change around masks, social distancing, etc., to get to a point where we can see declining cases and hospitals not on the brink or already overfilled? And I'll just add to that, we're aware that, in our 4 states of the Synod, the numbers are not going down, they're rising. In Mississippi, it's reported that within the next couple of weeks, it will be the largest number of cases in the nation. So what can we do to, I mean, I've been doing a mask campaign for our Synod and showing people of all different ages and such wearing masks and trying to write letters to our governors. But we'll start with you, Dr. Ricks. Do you have any other advice for or suggestions that we can engage our congregations and to advocate for this? And then Taylor, if you want to add anything briefly with that.
Sure. If you guys let us know. I think that all the things that you mentioned, Bishop Strickland, are really good ideas. I think it's political will, and so I think that whatever pressure people can bring to bear on our government leaders is important, because right now, many states are not requiring people to wear a mask, even in places of worship. It may be recommended and it may be suggested, but I really think it's a political issue, and I think it's, expecting our public servants to be good examples and asking them to do that, to wear a mask and to advocate for masks. So I think all the things that you are doing are good. I'll reach back to some of the communications department and see if they have some other suggestions, and I'll be sure to pass them on to you.
Yeah, and I just would add my own personal statement to that. You said it's a political issue. I think it's become a political issue because we politicized it. But I would like to see this as a human care issue, the care for our neighbor and the love of one another, which for me has more to do with our human right and ethic of that than partisan politics.
Absolutely.
Let me move on, because we've got a few more questions. I want to get to a few of these. Warren Bielenberg asked about, has anything changed from the Synod webpage from our document? The answer to that is no, mainly because we haven't added and updated, because we weren't going to do that until we got to phase 2. And we're not in phase 2. So we have not changed that. So the only is anytime there are updates from Dr. Bjornstad, who's on our call tonight, or Dr. Ulsterholm, who's a leading epidemiologist, we added his interview. We keep adding resources to that for you, so you might want to continue to check that out. The question is, we're told to open windows, but others say the air conditioning units take care of the virus, which is also similar to the other question, should we keep our ventilation systems running while we're not there? Dr. Ricks and Taylor, then you.
Ventilation systems should be, used when people are present. I don't think that it's particularly necessary to run ventilation systems when no one is there, except for to keep them, from being idle, as that's a mechanical issue. In terms of air conditioning, it is ventilation, so it is that, yes, you are moving air around, but you also have to be sure that that is vented, and that you're not just simply recirculating always the same air. We try and recommend that, on planes they have great HEPA filters, so these things screen things out from the air. It is not, to turn on the air conditioning to say that then takes care of it, that's just one part. But there is still social distancing, trying not to be in closed spaces, and keeping air flowing.
Thank you. The other question that we have is about mask ordinances. In Knoxville, they have a mask ordinance, and some of our counties do as well as some of our cities have instituted mask ordinances, even when governors of our states have not. Does it take more than one cycle of the virus for mask wearing to start a downward trend?
I will say no, because you have people. It's not as if everyone got infected on the same day. So there will always be this sort of rolling transmission, and so it will take a while before the mask wearing starts to show an impact. I mean, usually you start to see it after a couple of weeks. It also depends on where numbers were going. And it also depends on other factors, not just mask wearing and, social distancing, hand hygiene, all of these other things coming together. So it's not just as easy to say, we'll put on masks for 2 weeks and then we should start to see the numbers go down, because you hope that in a couple of weeks you'll start to see numbers go down, but then you'd still need to maintain a consistency to get numbers way down.
Thank you very much. We are a little bit over our time for this, and we have a few more things to go over. So what I'm going to ask is, as the next couple people are speaking, just in general about Synod updates, that what I would appreciate is in the chat box, if you would just share if your community is gathering in any sort of distanced way. I'm curious to know that. So if you're doing drive-through communion or outdoor worship or anything of that nature, I'm just curious to know that. Some of you have emailed me that from the last call, but that was about a month ago. So I'm just curious to see where we are with our 4 states. With the mask thing, and if you want to help your elected officials know how important this is, we have that information under our Advocacy Policy Council on the Synod website. And so I want to thank Pastor Taylor Byron-Edwards and Dr. Ricks for your time with us tonight. And again, I apologize for the technological issues that have come up. We want to hear from Pastor Michael Jeanette and Pastor Matt Steinauer quickly. So we'll start with Pastor Jeanette first. And if you would please mute Pastor Edwards and Dr. Ricks.
Okay, thank you. I do want to share with you for just a moment the Synod website. So I'm going to open up the Synod page here for just a moment. As you come into the home screen, Bishop, are you able to see the website?
Yes.
Sharing my screen. Okay, so just a reminder, COVID response up here. You can click on that, and we have a couple of top links here. And then we've cleaned this page up a bit, so it's sort of been categorized here. This may end up being pictures later on, but if you're looking for videos, anything related to worship, other digital resources like pamphlets or other information here, and then statements from Bishop Strickland and the ELCA, you can see all this here. Again, these top pages, these top links here are some of the items we've been talking about tonight. Resuming care-filled worship is what Pastor Taylor Byron-Edwards went over. There's a checklist for a pandemic. So there's resources right here for you just by clicking at the top link here. I'm going to switch gears and go back to the home page and just remind you that as you care for your rostered ministers, we do have, as the Mental Health Task Force, I'm going to put my Mental Health Task Force hat on, and remind you that we do have some workshops coming up, Tuesday, August 18th and Tuesday, August 25th. There are some workshops here, one related to burnout and fatigue, and then the other training for trauma-informed care. And then we are also working on respite options for all the rostered ministers. So we're continuing to care for them. And one of those ways that we care for them is by sharing our Synod sermons every week. There's a dial-in option, or you can download the sermon and include it into your pre-recorded worship service, or you can simply click on the YouTube link and play it that way. So switching hats again, just to share a word about youth ministry. The 2021 ELCA Youth Gathering has been postponed, and that's been communicated to your congregations or your youth leaders. They are going to be holding it in 2022 as of right now. And then the other thing that's on the forefront is the All Tennessee Lutheran Youth Gathering. That'll be coming up in November of this year. We are planning 2 scenarios, one for in-person and one for virtual. And we'll be making a decision on that soon as to what direction we're going to go. And I think those are all the things I wanted to share today. Anything else you need, Bishop?
I think that's it. Thank you. And again, you can contact Pastor Jeanette. His information, along with the rest of our staff, is on our Synod website. Pastor Steinauer, tell us about what's going on in the world of advocacy tonight.
Thank you, Bishop. I do want to just mention briefly that with many congregation leaders on the call, with some pastors here, being a pastor myself, I know people are hungry for fellowship, for worshiping together, they're hungry for the sacraments. And in our baptismal vows, if you think about to live among God's faithful people, bring them to the Word of God and the Holy Supper, teach them the Lord's Prayer, the Creed, and the Ten Commandments, place in their hands the Holy Scriptures, and nurture them in faith and prayer. That really takes in large account what we do when we come together in worship and Christian education, and that's what we are longing for right now. But there is a big so that leads us in the next part of our baptismal vows that says, so that your children may learn to trust God, proclaim Christ through word and deed, care for others in the world God made, and work for justice and peace. And that honestly is a way that we can continue to be and do church even when we're not meeting together. And I put links in the chat box for the Advocacy Policy Council Facebook page and the web page as well, and encourage all of you to be sure and visit and be plugged in there. The comments about the mask issue and how do we move people, that's an advocacy issue, and that is, as Bishop Strickland said, that is a caring for others. That's part of our baptismal vows. And so I encourage you to think about as we continue to figure out how to do worship in these very challenging times, that the church can also be about working for justice in the world. And so I hope you will join me in that. Thank you.
Thank you so much. And again, I just want to say thanks to each of you for all of what you do in your congregations. We have pastors and deacons on the line tonight, and you as council leaders and just faithful followers of Jesus who are part of the Southeastern Synod. I never thought that we would still be having these conversations when this all first happened, and yet here we are, and it continues. And someone asked me the other day, do I see a light at the end of the tunnel? I do, but it feels like one heck of a long tunnel. And you may feel that same way too. So you may have to just peer in the tunnel a little harder to find the light, but it's there. And so don't lose hope on that. And sometimes you may have to just step back from the tunnel and take a breath. And that's what I hope you're able to do, both as just people, but encourage your roster ministers to do that as well, as Pastor Jeanette reminded us. Just a quick word for me. I am so thankful for each of you and for all of the generosity that you continue to shower in this synod. You are faithful and generous people. And if it were not for each of you and your congregations, we cannot do the work we do as synod and wider church together. But we need each other. We know that finances are difficult and things are hard. But I wanted to be really transparent with you this evening and say that even as you're struggling in your own congregations with offerings financially, that also means that as a synod, we struggle with offerings financially. We call that offering mission support. And we're intentional about calling it that because it helps us support the mission that God has called us to as we live out our baptismal calls that Pastor Steinauer has reminded us of. From April until now, we've been running a fairly large deficit in what giving has been with mission support from congregations. I realize you can't give what's not coming in. We also can't give out what's not coming in. But I do encourage you, as much as you're able, to please be of good cheer and continue to be good and generous givers to the wider mission of God's creation in the synod and the wider church. Even in the midst of what might feel like scarcity, we have God's great abundance. And as a synod and as the ELCA, we've been able to give away money in the midst of this pandemic that has been given to us through grants of COVID-19 grants, as well as World Hunger grants. So we've been helping to feed people. We've also been helping to offset the cost of salaries of pastors and deacons and congregations. We're able to do that because of generous givers who give specifically to those causes. But like you, as a synod, we have our regular bills we have to pay too. So I appreciate everything you're doing and encourage you to continue to be good and generous stewards. If your mission support in your congregation needs to change or has changed, to the allotment to the synod, I would appreciate knowing that. So if you would reach out to me personally and let me know that, I'd be happy to hear from you so that we can plan accordingly as a synod. And if there's anything I can do for you in far as coming and speaking with your council, or just giving me the opportunity to worship with you and our staff on a Sunday morning, any of us would be willing to worship with you and even lead worship with you during this time, and just bring a word of God's hope and greetings to you. So thank you to each of you, and know that you are much loved and much supported, and we will get through this together and by the grace of God. So may each of you have a good night, and may you know that you are dearly loved by the one who's called you by name. Amen.